If you have back or neck pain, you've been to your doctor and you've been probably examined and you're trying to wonder what are all these things that these doctors are doing to me to figure out my pain. Well, I want to talk to you about the physical exam, that part where they move us around, and I'll tell you which things might mean what when you're having these tests done. I'm Dr. Myrdalis Díaz-Ramírez here at Dr. Two Spine in Tampa, Florida, and we do have a concierge regenerative medicine and pain management clinic where we treat our patients without surgery or opioids. And today, with the help of my assistant, I want to go over this physical exam with you. So let's start. And first, why is this important? Well, we have many patients who come to us and they say, I have back pain, I don't know why. Yeah, we start there with a blank slate. But we might have some others that come and they say, I have pain, my L4-5 is hurting me, my disc is herniated, and that's the cause of the pain. And that might be completely true, but it might not be the whole story. So we need to map and figure out where your pain is coming from, and the physical exam is super important to do this. Let's focus on the lumbar area. We have a neck, that's the cervical spine, we have the thoracic spine, and we have the lumbar spine. And L will be the first letter that we're going to mention for each bone. We have 5 bones in the lumbar spine, and in this case, we're going to start from the bottom up. So L5, L4, 3, 2, 1. Okay? The disc is like a shock absorber between these bones. The disc is going to be named after the bones above and below. So if this is L1, 2, L1, L2, that disc is L1, 2. Then, what is a bulging disc? What is a herniated disc? What is having a tear, torn disc, or a degenerated disc? If there's some forces that push that disc or press that disc can displace a little bit like a balloon when you squeeze it, right? And depending on how much that is displaced, it's going to do different things and it's going to have different names. If it's displaced a little bit, it's called a disc bulge. If it's displaced more, it can be called a disc herniation. And what that does is not give you pain necessarily. It usually gives you pain because that displacement or herniation, they're pressing against something. In the lumbar spine, once we're past the L1, L2 level, we usually just have in the spinal canal, in the back part, just strands of nerve. So at this level down here, L3, L4, L5, it's not really pinching your spinal cord. The spinal cord is above that level. So it can pinch some of your nerves. Depending on the nerve that is pinching, then you feel symptoms going down what we call the nerve root if it's done up here. So when we're examining you, we're trying to figure out which nerve is pinched, if any of them are pinched, if the disc itself is giving you pain, if the joints in the back are giving you pain, or the tendons or some other area. So it's important that we know we have maps that are called dermatomes. And for example, we know that if you have the L4 nerve, which comes out of that L4-5 space where that disc L4-5 is displaced, doctors have already memorized these maps. And in your exam, we're going to look for things that might guide us to an L4, for example, problem. If this nerve is pinched, you might have problems coming from your low back all the way to the front of your knee into your toe, right there. So we're going to examine you for strength along that distribution. We're going to examine you for sensory along that distribution. We're going to do like these things that are called the reflexes, looking for those nerves to see if they're affected. Also, we're going to do different movements. We will probably have you lay down and then raise your legs. When we're raising your legs straight up in the air with your being flat face up, that can be called a straight leg raising test. And if you have pain because one of the herniated or bulging discs are pinching one of these nerves, we might have symptoms down that nerve root in those map distributions that we already learned. So if you're laying down, we do this test and we see that you have a symptom down that leg in the pathway of one of those nerves, we might think that yes, that might be your disc that's giving you the problem because it's pinching something. So that's a very important test that we do. We also check on your spine. We have you, hey, can you bend over, go like this, go like that, then backwards. So depending on what movement we're doing is the part of the spine that we want to stimulate. This is the front This is the back. You have these bones here, they're called spinous processes. And then in your back, when you touch here and you see that bone, it's curious to me because some people have not really felt that before, and they come to me and they say, oh, now I have this bone here, but they have all their lives had it, but this is the first time that they feel it because it's the first time that they have pain. So that's the spinous process. So that's the back. That's where you touch and you have pain, even though it might be coming from these areas in the front, can reflect in the back as well. When your doctor tells you to bend forward, bend to the front, guess where we're putting pressure? We're putting pressure on those discs. So if you're having symptoms there, we might think, oh yes, that disc can be involved. And when you have, for example, a disc tear where you have some strength that happens, some forces that happen, and they cause like a little tear of the disc, nerves can grow there. We can have some leakage of the material from inside the disc outside, which is not normally supposed to happen, and those things can give you pain. So if we stimulate you going that way, then we can say, oh, you know what? The pain might be coming from that disc, right? Here, facing to the front, if your doctor presses you from the side, and from the side, it's called a side glide. I tell the patients that I'm going to give them a strange hug. Don't choke me when I'm doing that. And then I hug them from one side and to the other. We're also trying to put some shear forces into those discs to figure out when we have some type of doubt or as part of a regular physical exam. The back. If you see, we have two bones coming together and they form these things that are called facet joints or hypophyseal joints. Yeah, they have funky names. And those joints can hurt. If you've heard the term whiplash, this is where whiplash most of the time happens, in the back. It's a lot in the neck, can happen when we have an accident, a fall, something like that. It can also happen in the low back and the thoracic spine too. So we have the two bones that come together from those joints. What we don't see on an MRI, for example, is that these joints have little ligaments and tendons that really you cannot see on testing that we have, unless like it's something very prominent. So most of the time we won't see that. And we know from previous studies where they examine cadavers that you can have tears, and we know that those tears that happen into those little ligaments can be producing pain, and this is very common, especially in car accidents, for example, or somebody who's had a fall. So a way of examining that is that when we ask the patient to go back, because going back, guess where we're putting pressure, right? In those facet joints, okay? The other thing is I tell my patients is a movement that is going to load. So we're going to do facet loading on one of those sides. So we tell the patient to move to one side. So it would be keeping your hips there, turning to that side if we're going to the right, and going back. So looking from the back, if we go to the side and we go back, we're putting pressure on these ones here. And these ones, the L3, 4, 5, and S1 area, that's the area that's most commonly affected because that's where we have a lot of the movement on our spine. The other things that we look at is tenderness. If you have a lot of pain when we're touching you, just with little pressure, there might be something broken in your spine, or you might have some tears of the ligaments that are here, not in this model, not with my assistant. My assistant is already so dried, but you can have it in the normal person that has ligaments here, 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 and those can be torn, and that can be a source of pain. Muscle can hurt. Like for example, suppose that I come with this, right, and I hit you very hard in the muscle and I don't break anything, it's still gonna hurt, okay? So the same thing can happen in muscle all over the body. So you can have pain from the muscle itself, and all the things that we're doing with our physical exams are trying to figure out where that's coming from. People will come and say, I have sciatica, and I say, what does sciatica mean to you? And they tell me their answer. Sciatica means pain down the sciatic nerve. The sciatic nerve is a big nerve that starts up here in the area like L4 or 5, S1, and goes down the back of your leg. So you can have that pain down your leg. But the thing is that not all sciatica is due to that herniated disc, even if you have one. So pain down the sciatic nerve can be from problems to the sciatic nerve that can happen here, or even down past on your buttock. There's something very common that's called Peary syndrome, and it's this little muscle that goes along like that, and it's in your buttock. And then in the physical exam, we stimulate that, and we're able to reproduce your pain, and that has not necessarily anything to do with the disc. It might be just on its own. It might be that you have both things. So that physical exam helps us with that. Something that can also give you some leg pain, and you don't know about this, is the sacroiliac joint. So here, this big huge bone that forms like a V is called the sacrum. Normally we would have the pelvis, which is the other bone that comes around. Where that big huge bone of pelvis and this other bone that unite right here, that's called the sacroiliac iliac joint. Okay, and that can give you pain into your back, into your groin, into your leg, going down the leg, and you can think that that's maybe sciatica or maybe this is causing it, but it's not. All along it was that joint. So we're going to do different movements in your physical exam to just isolate things from the sacroiliac joint. Normally I will do like 6 movements when I'm examining you, and then it takes like 3 of them to be positive to really think that it's coming from there. And even though we have a positive physical exam, we might still need a diagnostic test to make sure that we're not missing something. We can talk about diagnostic tests later, okay? So I think that gives us most of the things that we could normally talk about on physical exam. For the lumbar spine, yes, I'm missing a lot of things. The iliopsoas muscle, for example, there's a big muscle that goes from the front all the way down, and there's some other muscles, but I think that you might get a little bit bored. I think you have some understanding right now. I did not focus a lot on that sensory and motor and deep tendon reflexes exam. Is super important, and you have to make sure that when you're examining a patient that that's included, to make sure that we're not missing a nerve problem. I'm going to put my assistant to the side, and then when we're doing sensory exam, we can do sensory with light touch, so me touching you, or with some object. We can do temperature testing, we can do vibration testing, we can do what we call pinprick, which is something sharp, pointy, for your sensory exam. It's important to do these exams. Sometimes the herniated disc, as I said, is not all the story. It might be one of so many things. It could be what we call a neuropathy. And neuropathy is the damage that's been to a nerve, or nerve that's just not working well. It can be due to your diabetes, to some other trauma that you've had, infections. So many things can happen. So the physical exam is not everything. The history is not everything. An MRI is not everything. We put all of these things together, and then we make what's called a differential diagnosis. That differential diagnosis means that we have made a list of the most likely things that could be causing your pain. Your disc is probably going to be included if you have one of those problems there. I do have to tell you that, for example, if you take 100 people from the street in their 30s with no pain, 30% of them are going to have a problem in their MRI, and that can be a disc problem. It's not that I'm not saying that your disc is not the problem, it's that for your benefit, to make sure that you have a full story to what's happening to you. We just don't want to get the big thing and then forget about the other things that could also be giving you some discomfort and affecting your quality of life. I hope that this little class was a little bit useful for you, or a lot useful for you. And if you have any questions, we're publishing more videos. You can go to our YouTube channel, Dr. To Spine, or our website, drtospine.com, or you can make an appointment with us and meet us here in Tampa, Florida. Our phone number is 813-597-3405. Have a fantastic day.